What happens when governments start to treat healthcare not as a fundamental right, but as something optional, something that can be set aside or left to others to handle? When public systems falter, the consequences ripple through entire communities, often quietly, but with devastating impact. In this world, charity clinics and pop-up health events step in to fill the void. They offer hope to those left behind, providing essential care where none exists. But while these efforts are inspiring, they also mask a much deeper, more troubling problem, one that's easy to overlook. Smiling volunteers and dedicated health workers give their time and skills, transforming community halls and empty rooms into lifelines. For many, these makeshift clinics are the only form of healthcare they'll ever know. The gratitude is real, but so is the underlying sense of uncertainty. But we have to ask, why are these clinics even necessary? Their very existence points to a system where governments quietly step back, shifting the burden of care onto charities and volunteers, rather than ensuring health as a public good. The harsh truth is, when the donations dry up or volunteers move on, the care disappears too. Patients are left stranded, forced to wait for the next wave of charity, or worse, to go without help altogether. This cycle of hope, brief relief, and then abandonment repeats itself over and over. It's not a sustainable solution. It's a patchwork that leaves people vulnerable, never knowing when or if help will return. We rightly celebrate the organizations and individuals who step up, but the fact that they're needed at all is a sign of a much larger, global failure to provide basic health care for all. Instead of a system based on rights and reliable care, we have a lottery, where millions depend on luck, timing, and the generosity of strangers, rather than on strong, accountable public systems. In this video, we'll dig deeper into the world of healthcare by charity, exploring who truly benefits, who bears the cost, and what must change if we want real, lasting solutions for everyone. So, what is a charity clinic? When we talk about charity clinics, we're talking about a unique kind of healthcare provider, one that steps in where traditional systems fall short. These clinics are often the last safety net for people who have nowhere else to turn, offering care to those who might otherwise go without. It's any healthcare facility run on donations, not government funding or patient fees. Instead of billing patients or relying on insurance, they depend on the generosity of individuals, organizations, and sometimes even small businesses in the community. Every bandage, every dose of medicine, every hour of care is made possible by people who believe healthcare should be accessible to all. These clinics come in many forms. Some are massive hospitals in war zones, set up almost overnight to treat the wounded and displaced. Others are tiny church-run clinics in small towns, operating out of modest buildings or even converted homes. But their mission is the same: fill the gaps left by broken systems and reach those who need help most. These clinics are run by international NGOs, faith-based groups, and local heroes, people who see a need and refuse to look away. They bring together doctors, nurses, and volunteers from all walks of life, united by a common goal. Funding comes from donors, corporations, and sometimes even the very governments whose systems they're supplementing or replacing. The services they offer are shaped by the needs of the communities they serve, from maternal care and childhood vaccines in poorer countries to diabetes checks, dental care, and chronic disease management in wealthier ones. No matter where they are, they adapt to what's needed most. But these aren't high-tech hospitals with the latest equipment or endless resources. They run on old equipment, overworked volunteers, and tight budgets. Waiting rooms are crowded, care is often fragmented, and resources are stretched to the limit. Follow-up is a luxury, not a guarantee. Many patients may never see the same provider twice, and continuity of care is a constant challenge. Charity clinics are a mirror, showing us exactly where our health systems fail. They highlight the cracks in the foundation, the places where people slip through. This is healthcare on the margins, driven by good intentions, powered by heroic effort, and always facing constant limitations. Yet, in these humble settings, hope and compassion persist, proving that even in the toughest circumstances, care can make a difference. Counting charity clinics is nearly impossible. They're everywhere, often invisible, but essential. In some African countries, NGOs and faith groups provide up to half of all health care. In the US, over 2 million people rely on free clinics each year. These clinics form a parallel system, catching those left out by official healthcare. In places like Haiti, NGOs run most health services. In Europe, mobile clinics serve refugees who fall outside national systems. This patchwork is fragile, built on donations, not stability. Donor-driven programs can even weaken local health systems by pulling focus from primary care. The scale of this network is both inspiring and a stark indictment of political neglect. Charity clinics are everywhere because governments aren't. In disasters and crises, charity clinics are lifesavers. First on the ground, providing emergency care when governments can't. Beyond emergencies, they offer vital services like fistula repair in Africa, restoring dignity where no other care exists. These clinics often pioneer new, low-cost ways to deliver care, innovations that sometimes influence national policy. Organizations like Partners in Health have shown that even complex diseases can be treated in the poorest communities. Embedded in local communities, charity clinics build trust and offer compassionate, culturally sensitive care. For millions, the charity clinic is their only link to modern medicine. Their work is a testament to human generosity and ingenuity. But their necessity is a sign of deeper systemic failure. The charity clinic model, while often well-intentioned, is built on a shaky foundation with serious flaws, starting with sustainability. These clinics are meant to fill gaps in care, but their very existence highlights the failure of more permanent solutions. Funding is unpredictable. A shift in donor priorities or a sudden economic downturn can shut clinics overnight, leaving entire communities stranded without warning. For many, this means losing their only access to healthcare. The quality of care also varies wildly from one clinic to another. Some charity clinics are excellent, staffed by dedicated professionals and well-equipped. Others, however, are dangerously underregulated, lacking oversight and resources. This creates a two-tier system where the poor must accept whatever is available, while others can access better care elsewhere. This inconsistency undermines the very idea of healthcare as a right, turning it into a privilege for those who happen to live near a well-funded clinic or catch the attention of donors. Charity can also create dependency, discouraging governments from building their own robust public health systems. When outside organizations step in, local leaders may feel less pressure to invest in sustainable solutions. Why invest in public health infrastructure if NGOs and charities are already doing the work for free? This question lingers in the minds of policymakers, often leading to chronic underfunding. This crowding out effect keeps national health systems weak and fragmented, especially in rural or marginalized areas where the need is greatest. Worst of all, charity clinics can let governments off the hook, masking official neglect and allowing politicians to redirect public funds elsewhere, often with little scrutiny. The applause for charity, while heartfelt, can drown out the urgent demands for real accountability and lasting reform. The result is a cycle where temporary fixes become permanent excuses, and the root problems remain unaddressed year after year. The cracks in the foundation are growing, and if left unchecked, they threaten not just the vulnerable, but the health and stability of entire societies. Let's tour the world's charity clinics. In Appalachia, US, thousands line up at pop-up clinics for basic care, proof of a broken system in a wealthy nation. In India's slums, NGO clinics are essential but often unregulated. Quality depends on luck. In Kenya, church-run hospitals fill rural gaps, but foreign funding makes them vulnerable to sudden cuts. In post-conflict Colombia, NGOs provided care where the government couldn't. Now, the challenge is building a permanent public system. Across the globe, charity clinics are both lifelines and reminders of government failure. Their presence is a solution and a symptom. When funding shifts or priorities change, care disappears. The challenge everywhere: move from emergency aid to sustainable state-run healthcare. Until then, millions depend on the charity lottery. Charity's good deeds can let governments off the hook. When an NGO opens a clinic, politicians quietly cut health budgets, redirecting funds to more visible projects. The charity clinic becomes permanent, institutionalizing neglect. Governments manage NGOs like a marketplace, plugging holes without real investment or planning. The result: a chaotic patchwork, not a coordinated system. Donors feel good, but rarely see how their generosity props up dysfunction. The charity sector, despite its best intentions, can become an unwitting partner in government evasion. It's a classic case of treating symptoms, not the disease. Real change means holding governments accountable, not letting them hide behind charity. So, how do we move beyond endless band-aids? First, Governments must see health as central to all policy, not just a budget line. Smarter partnerships are needed. NGOs should work under clear contracts, with plans for governments to take over. Donors must fund long-term system building, not just short-term projects. Invest in training, supply chains, and national health data, not just clinics. Models like Gavi show how co-financing can build sustainable systems. Finally, demand transparency. Citizens must track health budgets and hold leaders accountable. Real change starts when communities demand their right to health, not just charity. Charity clinics save lives, but they're not a just or lasting solution. Access to healthcare shouldn't depend on luck or charity. It's a human right, and governments must guarantee it. We need to change the conversation. Celebrate volunteers, but ask why charity is needed at all. Support organizations that build systems, not just deliver services. Use your voice. Demand your government invests in universal healthcare, at home and abroad. Vote for leaders with real plans, and support journalists and activists exposing neglect. The power to change this is ours. The bake sale is over. It's time for justice, not charity. For more videos from Health Explorer channel, like, subscribe, and share. See you on the next video.